Mwaniki omonene ase wizara y'obochenu Mary Muthoni nigaereire kubwatirana ne serikali obosio bokweroberia ase ogwateka kw'oborwaire bwa Ebola. Koreng'ana na Mary Muthoni nigo bagendete kubwatirana ne chinse chinde buna USA ase kobeka ensemo bari baratoke n'oborwaire obo babe bagokonyerwa aroro nonya nabo nigaineke buna goikera bono iga ense ya Kenya teraenekia oborwaire obo koreng'ana n'oboringoria bwakorirwe obwango iga.
As at yesterday, we do not have any confirmed case in Kenya. Yes, we have had samples. We have taken them to the laboratories, the designated laboratories, because not all laboratories have the capacity to do that. And we remain at risk of the disease importation. So let's all be careful. If you don't have an urgent travel in those countries, why do you have to go? Kaa hapa. Then also mapped out the high-risk areas, in our country. But we are continuing to screen people, travelers. More than 55,000 travelers have been screened. We do not have any traveler in isolation as at now. We do not have any traveler who has been taken on referral. We have our rapid response teams on the ground, 24/7, 24 hours on standby also, just in case there is any call. I want to say that international collaborations happen every other day. And when there is a discussion around having an isolation center in Kenya, it's not a bad thing, really. And it's a discussion. Because emergence of diseases and re-emerging of diseases will keep recurring every other time. Really, as a country, we must be ready. And these are not strange things. Even during COVID, we had isolation centers in our country. Even the counties are supposed to have isolation centers. Today, we are at risk because of Ebola. If we have it here in our country, what happens? We will need isolation centers. We are also very deliberate on long-term investments in terms of health systems, public health surveillance, and workforce development. And notably, Kenya health professionals previously, we have supported other countries in the response, and especially during Ebola outbreak in West Africa between 2014 and 2016, we had to send our healthcare workforce to go and assist them.